Is a court scan needed for diverticulitis with nausea and vomiting? When someone experiences nausea and vomiting alongside suspected diverticulitis, it raises important questions about the need for a court scan. Diverticulitis occurs when small pouches in the colon, known as diverticula, become inflamed or infected. Common symptoms include abdominal pain, often in the lower left side, and sometimes nausea and vomiting. These additional symptoms can indicate a more complicated form of the condition. A court scan is generally recommended when diverticulitis is suspected, especially if nausea and vomiting are present. This imaging technique is the most effective way to confirm diverticulitis and assess its severity. It can also help identify any complications, such as abscesses, perforation, or bowel obstruction. The diagnostic accuracy of court scans is quite high. They have a sensitivity of about 94% and a specificity of around 99% for diagnosing diverticulitis. This makes court the gold standard for suspected cases. When nausea and vomiting occur, they may signal a more serious progression of the disease, which is why court imaging becomes particularly important. Clinical guidelines suggest that court scans should be ordered when there is uncertainty in diagnosis or when systemic symptoms, like vomiting, are present. This is especially true for individuals with risk factors for complicated diverticulitis, such as those with weakened immune systems or prolonged symptoms. While court scans are very useful, there are alternative imaging options. If a court scan is not available or poses risks, such as during pregnancy, an ultrasound may be used. However, ultrasounds are generally less detailed and not as reliable for evaluating intestinal conditions compared to court scans. It is also important to consider the risks associated with court scans. They involve exposure to radiation and potential side effects from contrast materials used during the procedure. However, in cases where nausea and vomiting suggest complicated diverticulitis, the benefits of accurate diagnosis and appropriate treatment usually outweigh these risks. In summary, if you or someone you know is experiencing diverticulitis with nausea and vomiting, a court scan is typically needed. It helps confirm the diagnosis, evaluate the severity, and detect any complications that may require specific treatment. Always consult with a healthcare professional to determine the best course of action for individual circumstances.